Odds are that you have had, do have, or will have low back pain in your lifetime. It's the leading cause of global disability in working-age people. Spinal pain is huge business in the U.S., with more than 1.5 million surgical procedures performed yearly and annual expenditures of over $135 billion. Potential causes are many. Generally, strengthening, flexibility exercises, healthy nutrition and lifestyle are your best insurance against problems. But sometimes low back pain is simply unavoidable. And if you're a chronic sufferer, trust me, you'll try anything and everything you think might possibly help. Unbelievable as it sounds to me, I've practiced applied kinesiology chiropractic for 37 years, since 1986. So why don't we get into my office and take a look at a patient with simple low back pain, and we'll give you a little behind the scenes on the way I go about evaluating and treating these kinds of things. Just a couple things before we start. There are many potential causes for low back pain. Some pathological disease disorders, disc herniation, chronic degenerative joint disease. But most low back pain is functional in nature. What do I mean? Well, abnormal pelvic and lumbar motion, sprains, strains, overuse injuries, those kinds of things. That's what I'll be assessing today. Now, applied kinesiology is a system of diagnosis and treatment using manual muscle testing as a functional neurological tool. Wow, what do I mean by that? Well, obviously muscles are under the influence of the nervous system. Clearly then, muscle testing might be a valuable window into nervous system's functioning, yes? Okay, you've seen it before, a bunch of vertebrae stacked on this 3-bone foundation known as the pelvis. Yeah, 3 bones pelvis, not one big one. Ilium, sacrum, ilium, sacroiliac joint, left and right. And these bones fit together beautifully and move in synchrony as we move, just like this. Now the brain sits on top and controls the show, as you know, right? It's the conductor of the whole orchestra. Information down the spinal cord, out these nerves between every vertebra, information flow to every cell in the body. However, and this is super key, there's a lot more information traveling up to the brain than there is down. It's called the sensory nervous system. The brain is continually receiving information from every cell in the body and responds the best way it can accordingly. So basically, it's a responsive organ, and its output is only as good as its input. So when joints and muscles move abnormally, guess what? Static in the feedback system. Result, brain confusion, abnormal muscle tests. One other thing I might recommend is to check out a few of my videos on applied kinesiology, the vertebral subluxation, and so forth. Might set you up better for this video, okay? First, let's hope Tekoa is cool with our video plan.
Absolutely, my pleasure.
Okay, that was easy enough. So remember that the brain's command over all systems in the body is totally dependent upon the quality of the feedback it gets from receptors in literally every cell and tissue. And there are countless ways in which static can find its way into that feedback loop. Chiropractic manipulative therapy in and of itself is a hugely powerful corrector of feedback dysfunction, but I think it's just as important to assess feedback from the muscles as well. That's where various soft tissue techniques come in handy, but let's start here by challenging the pelvis. Camera angle not ideal, but Tekoa is exhibiting some dysfunctional movement patterns. Muscle testing on table further illustrates imbalances, suggesting some blocked ranges of motion at a hip joint. I always try to stimulate as much sensory feedback to the brain as possible during my treatments. And shout out here to my colleague, the great Dr. Bill Koch in Mount Dora, Florida, who taught me so much a few years ago about the invaluable instrument I'm using here, the arthrostim. Addressing that issue restores normal feedback from joint receptors, and inhibited muscles are often immediately turned back on, as we see here. Now, with Tekoa's left femur head freed up, mechanical receptor feedback facilitated via arthrostim, and the gluteus medius muscle turned back on, I set the blocks and adjust her pelvis. Femur head is good. All right, cool. All right. Now we know as part of this deal, we use these wedges as a lever system to first free up the two ilium bones in the face-up position, then the sacral movement pattern problem face down. All right, hold your left arm out. Resist. Good. Continuing with our testing of important pelvic stabilizer muscles, Tekoa's right piriformis tests nice and strong. While she just cannot engage the iliacus at all, there's simply nothing there. Doesn't change. You're going to do this. Now notice that the muscle turns right on immediately after I challenge the pelvis in a negative y-axis rotation, or counterclockwise as you might picture it, suggesting that it's not an actual weakness, but more of a compensation for that rotation. Correction of that malposition creates an instantaneous feedback loop reset, and the muscle turns back on beautifully. Good. In, hold. Nice. Okay, off the table. Hold me up. Next, let's check the gluteus maximus. The left locks up nice and strong, not so for the right. My first thought is to challenge that hip joint, but retest shows no change. Femur head anterior. All right, so I'm going to push this backward. We're going to try it again. Lift, hold, beautiful. Gluteus max attaches here. That goes weak. Turns out that the blown circuit was at receptors known as Golgi tendon organs, located at the musculotendinous interface. Manual stimulation of that reflex did the trick. So from here I'll muscle test my way up the spine, challenging vertebrae left and right. Stressing poorly moving joints or subluxations into direction of greater dysfunction will create mechanical receptor overload, positional sense problems for the brain, and inhibition of previously strong muscles. This testing is my indicator of level and direction of spinal correction needed. I'll treat using a combination of instrument and manual adjusting techniques. Empirical data has been accumulating for decades on the association between and interrelatedness of organs, glands, muscles, and nutrition. In applied kinesiology, we consistently observe that underlying uncompensated stress on a particular gland, for instance, is often a contributing factor in unexpected weakness on tests of specific muscles. Example, the sartorius, the longest muscle in the body, without doubt fails on manual muscle testing more than any other muscle. We associate that with adrenal gland function, and it's an important pelvic stabilizer. The complicated topic of organ, gland, muscle, nutrition, relationships in AK is deserving of a full, dedicated video. Maybe I need to put that together sometime down the line. But today, in Tekoa's case, I'm recommending a whole food-derived vitamin C complex called Cataplex C. So we'll be wrapping up our visit today with some testing of muscles around the neck. That's the cervical spine. Ooh.
The right here is.
Yeah. A small adjustment on C1, the top vertebra. And then an adjustment of a couple anterior vertebrae in the T-spine, or the thoracic spine.
And then it goes up in through.
A couple of ribs right there. Go over to me here. Is that okay for you? Finally, we'll free up a couple of ribs 1 and 2 on the right, and we'll get Tekoa up and see how she feels. Oh, she feels like dancing. Yours in vibrant health, Dr. J.